Carl, thanks for coming in today and sharing your story with us. I really appreciate you coming in. I mentioned we haven't had that many people who've had a colorectal or bowel cancer, so I think many viewers would really be interested to hear about your experience. The first thing that occurs to me is to ask you how your diagnosis came about. What early symptoms were you having, and was it screening? How was the diagnosis found, as it were?
Well, I noticed when passing motion, traces of blood, not great, but consistent and persistent. Most people are aware of the television sort of publicity. If just such a thing occurs, that it's the responsible thing to do to mention to your GP. I wasn't too concerned because I was already in the screening system, which is offered to all people of a certain age. But nevertheless, I did go to the doctor in a fairly cavalier mood, I suppose, just because I thought I'd better do it, and because I had mentioned the problem to my wife and got the necessarily sort of nagging to do so. I did, and that started the sequence of events which quite rapidly led to the diagnosis.
With those early symptoms you mentioned, were you worried there was something serious or sinister going on? Or did you think, this is just a routine thing, we can probably get this sorted?
Yeah, I thought it wasn't very dramatic. And as I said, I took some comfort from the fact that I had been screened within 2 years, obviously. So no, I wasn't fearful. I don't know much about medicine in general, but I know bleeding occurs for other reasons. I'd heard the words polyps mentioned, and of course there's the old familiar piles that everybody makes jokes about, which I hadn't experienced before, but wasn't impossible for that would be the diagnosis, which I would have welcomed in these circumstances.
So you went to see your GP. Now, how did you feel was the reception from your GP? How much did they take it seriously?
Well, I took it very seriously because, as I say, I hadn't prevaricated for ages, but it took me about a month to even consciously think, well, this isn't right, and this isn't a one-off. But so when he asked me how long it'd been, and by that time, because you make an appointment which isn't instant with a GP, but when I did mention it, probably about 6 weeks had elapsed, and he straight away, rather than shilly-shally, he suggested that I had a colonoscopy, purely as a precaution. He said, I'm sure there'll be nothing wrong, but, equally I shared his optimism and thought, well, I'm not going to fly in the face of the advice, so I duly received an appointment date, possibly within about a fortnight. It was fairly short time span between this conversation with him and receiving the appointment. Possibly I'd guess at about 2 weeks, but I wouldn't be held to that.
We have this new standard in the NHS regarding referral. If the GP suspects a cancer, then the hospital is meant to deal with it within 2 weeks.
So that's
about what you experienced there.
Yes.
And what was the next step then from the hospital? You had the colonoscopy, I presume, which is an examination of the bowel. What was your experience there like?
Never having been there before, there was a number of people having the same procedures. I suppose like any clinic in any situation, they do a job lot, so to speak. But the first part of it was to have an enema, which I've never had before, and I think most people, if only in a joking way, have got a rough idea what it's about, and it's not overly pleasant, but was obviously totally necessary to empty the bowel for them to have a look. So I went through that. I suppose everybody's experience of that is the same. You empty the bowel, but it wasn't traumatic. It was just strange. But I then had the colonoscopy, and it was apparent from the reaction of the gentleman doing it, whether you'd refer to him as a technician or a doctor, I don't know, that he immediately, quite briefly into the procedure, was aware of something that seemed to not alarm him, but arouse his suspicions, and he referred to another colleague, possibly a senior, I don't know, for guidance and another opinion, and the noises he made indicated that he shared the concern. He suggested to the first guy that he did a biopsy at the time, and I was offered the opportunity to turn my head and look at a screen that could see both the sort of probe and also the abnormality, which seemed to me to be a red bloody area in what otherwise seemed to be a pink area. So
that's a very good description. Do you think it was worth and correct them showing you the actual abnormality, because you were there at the time?
I think it was, because they didn't force me to look. No. I mean, it did, actually, I could have looked through the whole thing, and like most procedures, I wasn't that curious. I was not bothered to look. But as soon as the alarm bells were sounded, then things changed, and I thought I might as well look to help me to understand what they're saying as much as anything else.
Yeah. Just out of curiosity, was it the setup was such that you could see what was going on almost like accidentally, or was it designed to help you see?
The screen was easy to see, but you had to turn your head, which wasn't difficult, but equally I could look straight ahead and ignore it, or I could turn my head and observe, you know.
Mm. So there was this suspicious area. They took the specimens from the sampling at the time, and obviously they would have sent those off. Did they say any more about it at that time, or was that left to a follow-up appointment when they came back?
I think everyone sort of goes and gets changed, because you're in a hospital gown at this point, and most people seem to have some sort of follow-up dialogue from a doctor or person doing it. And because while I was sitting for mine, I heard reassuring noises being made to other people about polyps, and there shouldn't be. But the gentleman who did my procedure, and it was somewhere near the end of the working day, did sort of talk to me whilst I was waiting for this dialogue, and he did say that it would probably need surgery to correct it. He didn't venture a diagnosis as such, but and as soon as he said that, and the fact that he took the time to shake my hand and wish me well, and made me realise that this was something relatively serious.